You're watching your local news leader. This is WCIA 3 News at 6.
I feel like this is a real slap in the face to teachers.
That retired teacher is reacting to the news that Aetna's Medicare Advantage plan will be the only health insurance option for 140,000 state retirees for the next 5 or more years. It's an outcome seniors in Champaign and surrounding counties have feared for months. Good evening, I'm Jessica Coons.
And I'm Jennifer Roscoe. United Healthcare appealed that plan. We now know that was denied. That means Aetna officially gets the contract. Our Target 3 team is breaking the news tonight. Our investigative reporter Renee Cooper joins us now live from the newsroom. Renee, this actually hasn't even been published yet.
Yeah, Jennifer, all you can see on the state's trail map or the Retiree Health Insurance Program webpage is information about last year's open enrollment. At that point, there were a handful of companies to choose from, but that expires at the end of this year. Aetna will be the sole insurer after selling the state on a group PPO plan they've never previously held in Illinois. That leaves some pretty big questions, like will patients be able to keep seeing their doctors, and if so, will it be at an affordable price?
It doesn't give you any sense of security.
We first met retired teacher Vicki Good back in March. She's enrolled in Aetna's existing Medicare HMO plan through the Illinois Department of Central Management Services, or CMS. She's been struggling to find doctors since her plan stopped being accepted at Carle Health facilities, including more than 500 doctors within an hour of Champaign.
I'm concerned about Aetna.
Now, Good is looking at needing multiple hand surgeries. Her primary care doctor says she needs a hand specialist.
He said, I know a good one at Carle, but you can't go to Carle because of that, because you're with Aetna. So he is sending me to Springfield.
She still called Aetna to see if there were any closer options and got this list of 27 doctors. The first 3 were the wrong type of specialists.
And then the next 1, 2, 3, 4, 5 that they sent me were walk-in clinics. They're Christie walk-in clinic. I don't think I want to go to a walk-in clinic looking for a hand specialist.
In theory, Aetna's upcoming PPO plan should give her more options. Because of a federal waiver, the PPO ESSA, or Extended Service Area Plan, allows patients to see out-of-network doctors at an in-network rate if the doctor's office or hospital chooses to see that patient. But Carle, the major central Illinois provider, says it's still evaluating its, quote, ability to support these passive PPO members, citing cost concerns, and calling the assumption by CMS and Aetna that Carle should be available, as it was to state retirees before, quote, broad and misleading.
I was very seriously considering switching to United Health. Of course, now there's no United Health option. It's only Aetna option. And that seems to be almost like a monopoly to me.
Cutting the HMO option for retirees could pose a legal issue. The state's contract with AFSCME, the employees union, specifically says an HMO must be offered. Whether that extends to retirees, we haven't gotten an answer. AFSCME only said, quote, the terms of the retiree health insurance program are set forth in our collective bargaining agreement and must be met for the upcoming 2023 plan year.
I didn't make big bucks when I was teaching, but I taught because I loved it. And part of teaching, I always knew that there was going to be a pension there for me and that I would have health care. And now they're just kind of reneging on their promises to us of, what they would provide for us after we retired.
But why did CMS cut out the options? Well, they say it's because 90% of its enrollees already choose the PPO plan, although that 10% is nearly 20,000 people. Aetna also offered the state a $0 premium. It doesn't appear to offer retirees or employees that $0 premium, although the state claims the plan will come with a, quote, significant reduction in contributions. I'm working on getting much more detail online, including how lawmakers are looking to get involved. Live in the newsroom, Renee Cooper, WCIA 3, your local news leader.
All right, Renee, thank you so much. Now, CMS pushed open enrollment back to November 1st this year. The new plan will go into effect for enrollees January 1st. More information was promised to come in the mail and online by the end of October.